In this video, I will talk about the ethics of research with human subjects and consent. Research with human subjects is research conducted with or about people with the intention to do good. However, human research involves some risks, and it is possible that things won't go according to the plan. So, despite the best of intentions and care in planning and practice, sometimes things go wrong. Therefore, research with human subjects could raise ethical tensions between benefiting and protecting the well-being of research participants on the one hand and gaining new scientific knowledge to benefit society on the other hand. Some ethicists argue that patients' best interests must take priority over scientific objectives, while others argue that patients' best interests need not always take priority if patients agree to place their well-being at risk for the sake of science. One central way to protect research participants is informed consent. Informed consent means that participants are autonomous and competent to make decisions and have enough information about the research they might be involved and they understand what it entails. Informed consent promotes trust between subjects and investigators, but it also assures subjects that investigators will treat them with respect and protect them from harm. During the consent process, investigators describe not only the research goals, methods, and procedures, but also measures they will take to protect subjects' rights and welfare. Consent is a kind of mutual agreement between investigators and subjects in which both parties confirm their intentions to behave in particular ways. To avoid legal action, physicians must disclose enough information for the patients to consider and make an informed decision whether to participate in the research. Lack of informed consent is treated as professional negligence and is essentially the same as careless performance of a medical procedure. Researchers often face two basic ethical questions concerning disclosure. What kind of information should be disclosed? How much information should be disclosed? So, to guide researchers answering these questions and to help them know what and how much information they should disclose to participants, there are three main principles that the process of consent in the context of research with human subjects is based on. The principle of respect for persons and their autonomy, the principle of beneficence, and the principle of justice. I will start with the first principle, the principle of respect for persons and their autonomy in the context of healthcare and research with human subjects. The autonomy and self-determination principle sees the individual as a central decision maker, the one who has the right to make an autonomous choice and the right to perform autonomous actions. Thus, respect for the autonomy means that researchers must respect that individuals should make their own informed decisions about whether to participate in research. Those who cannot make autonomous decisions either are excluded from the study or participate based on a surrogate consent. Therefore, the principle of respect for persons and their autonomy requires that researchers or investigators obtain informed and voluntary consent from the research participants. In addition, respecting the autonomy of the participants also means that investigators have ethical and legal duties to protect privacy and confidentiality of the participants. For the participants to give a meaningful informed consent, they have to be informed about the nature of the research project. Clinical investigators have to tell the patients participating that the purpose of the research is different from clinical medicine and that the treatment will differ from standard care because the goal of clinical research is to develop scientific and medical knowledge, not to promote the best interests of patients. Patients may benefit from participating in clinical research, but studies are designed to develop medical knowledge, not necessarily to benefit individual patients. While in clinical medicine, the main reason for conducting a test or procedure on a patient is to obtain information that can be useful in diagnosis, prevention, or treatment. In clinical research, it is not allowed to individualize treatment because doing so would compromise the quality of the data by introducing uncontrolled variables into the randomized controlled trial. In addition, clinical investigators and their staff often perform tests and procedures on patients for the sole purpose of collecting data or samples for research, not to benefit the patient. So it is important that participants will understand that. This might affect their decision. Investigators should also inform participants about the procedures of the study. Researchers have to explain to potential participants what they should expect, what they will be asked to do in the research project, how much time will be required, and how often. The researchers should disclose any other alternative procedures or treatments that are available for the participants. Also, the study should disclose if involves randomization. The investigators should disclose all potential harms and benefits of the study. They should disclose medical, psychological, and economic risks and benefits in simple terms. Also, the benefits and risks of the available treatments comparing to the procedure the research study offers. Participants should be aware if their insurance companies may deny reimbursement for procedures that are not standard clinical care. Many times, research participants downplay the risks and are unrealistically optimistic about the benefits. However, prospective participants in clinical trials should also not underestimate the potential benefits. In clinical trials of cancer chemotherapy, for example, patients randomized to the control group have better outcomes overall than patients who are eligible to participate but choose not to. This may be due to additional benefits such as more intensive monitoring for adverse effects, greater attention to protocol details, and coordination of interventions by the research nurse. In addition, investigators have to make sure that the participation in the research is voluntary. Participants should not have any pressure in participating in research. And they should know that if they decline to participate in a study, this is not going to affect in any way their medical care. Even if they decide to participate in research, they should know that they can withdraw from the project at any time. The right to withdraw from research participation has been an ethical requirement since it was incorporated in the Nuremberg Code in 1949. Federal research regulations require that investigators inform subjects that they may discontinue participation at any time without penalty or loss of benefits to which the subject is otherwise entitled. Withdrawal is widely regarded as an important protection for human research subjects. Researchers should make sure that there are no misconceptions about the research. For example, one of the misconceptions is the therapeutic misconception, when participants do not understand how research differs from clinical care, and they often incorrectly believe that the study is designed to provide them a personal benefit, and that the procedure or intervention will be based on their needs. So, researchers should make sure that participants do not have a misleading belief that the research will provide direct therapeutic benefits to them. Moreover, it is important that they understand that the intervention is unproven and that they may not benefit and may in fact be harmed by the study intervention. Many promising new interventions fail to show significant advantages over standard therapy. Also, in randomized trial, participants may not receive the study intervention. The treating physician has a crucial role in helping the patient make an informed decision by eliciting and correcting any misunderstandings and encouraging the patient to ask questions. In some cases, the treating doctor may make a recommendation about participating in the research project. When a clinician is also the principal investigator, it might be difficult to manage the dual responsibilities as clinician and as investigator. So disclosing this information is very important because it promotes informed decision and transparency. patients might decide that individualized care is better for them. A conflict of interest in research occurs when investigators have a financial, professional, or other interest which is likely to affect their tendency to fulfill their professional, ethical, or legal obligations. For example, if a private company is giving a major gift to a university or supporting millions of dollars of research, institutional leaders may make decisions that favor the company and compromise the academic mission or scientific integrity. The investigators should disclose any financial interest in the study. Or another example, if a physician who is enrolling patients in a placebo-controlled clinical trial in which an effective therapy already exists has a conflict between his or her duties as a physician and his or her duties as a researcher, conflict of interests raise ethical concerns not only because they can increase the risk of bias and affect the results, but also because they may influence interactions between investigators and subjects during recruitment and consent. An investigator with a conflict of interest may be strongly motivated to recruit subjects for a study so he or she can generate results. The investigator may overemphasize the benefits of the study or downplay its risks to encourage an individual to participate. See, for example, the following case. To encourage enrollment in a clinical trial of a new antibiotic, physicians are offered $350 for referring patients who subsequently enroll in the study. Finder fees is money or other reward given by the sponsor to a physician for recruiting a patient into a study. Completion fees is money or other reward given by the sponsor or by a physician to a physician for each patient who successfully completes the study or trial. These types of payments raise concerns because researchers and their colleagues may be enticed by these financial offers. So they may be tempted to enroll individuals in studies for which they are unqualified to participate, or these individuals just won't benefit from this study. So a physician receiving fees for patient recruitment or patient completion can be a conflict of interest since there is a difference between the physician's private interest and his or her obligations to the patient. Of course, in some studies, even if the physician receives fees, there could be no conflict of interest, but still the physician has to disclose this to the participants. So the second principle is the beneficence model. The beneficence model is the idea that the physician's primary obligation is to provide medical benefits. Physicians have the duty to try to benefit the patient and should act in patient's best interest. The welfare of the patient is the goal of healthcare. Physicians ought to prevent, remove, or minimize harm, pain, and suffering, and promote good. The beneficence principle in clinical research context requires that the research design be scientifically sound, and that the risk of the research be acceptable in relation to the likely benefits. Risks to participants include both physical harm from research interventions and also psychological harm, such as breaches of confidentiality, stigma, and discrimination. While in the past clinical research has been regarded as risky, and potential participants were considered guinea pigs who needed to be protected from dangerous interventions, these days clinical research is regarded as beneficial rather than risky, because it provides access to potentially life-saving new therapies in such conditions as cancer, HIV infection, and organ transplantation. Patients with such conditions might want increased access to clinical research, not greater protection. Still, there are cases when research does not benefit its participants. For example, if the research question has already been settled, or if the design of the study is so weak that valid conclusions are impossible. In these cases, no risk to participants can be justified. The risks of participating in the study must be minimized, for example, by screening potential participants to exclude those very likely to suffer adverse effects. Another example is that it is unethical to conduct a randomized placebo-controlled clinical trial when there is an effective treatment for the disease. because physicians do not offer medical benefits to subjects in the placebo group, and this violates the physician's professional duty to benefit her or his patients. Consider, for example, the following case. Miss L is a 17-year-old woman with a family history of osteoporosis. She is interested in entering a randomized placebo-controlled phase 3 clinical trial of a new preventive agent that is given once a year. Currently approved drugs that are effective in preventing osteoporotic fractures need to be taken by pill once daily. Even though a research study has been approved, the balance of risks and benefit may not be appropriate for some patients. In this case, Ms. L would like to be enrolled in research that she might receive a placebo while an effective treatment is available. In some cases, the risk of forgoing standard preventive measure is small and negligent. Then being enrolled in research where she might receive a placebo is acceptable. However, for some patients, the risks are higher and are unacceptable. For example, if Miss L is at an increased risk if she declines the standard drug because she has a very low bone density, previous compression fractures, or a history of falls, a risk of fracture is greater. The risk in her case outweighs the benefit. Therefore, her personal physician should ensure that Miss L understands these risks and recommend that she receives a drug that is known to be effective, rather than enrolling in the clinical trial and receive placebo or an unproven intervention. This case shows the ethical tension between benefiting the patient or gaining scientific knowledge. There are other cases where patients may be at an unacceptable risk in a trial because they are more susceptible to adverse effects of drug being tested. For example, because of pre-existing impairment in an organ system in which adverse effects usually happen. Whether the patient's best interests must take priority over scientific objectives, or patients' best interests need not always take priority if patients agree to place their well-being at risk for the sake of science, the patients have to be informed of all the options and what will benefit them. Investigators should ensure that patients understand that treatment will be randomly assigned if they are participating in a randomized controlled clinical trials, and that they may receive a placebo instead of a treatment. Therefore, it might be better for them to select the available treatment. The principle of justice is also important in the context of clinical research. Before we discuss the issue, let's start with a case study. A new urinary catheter has been developed. A clinical trial is proposed to evaluate whether it is more effective and safer than a conventional catheter. Nursing home residents with Alzheimer's disease and incontinence will be recruited as participants because enrollment and follow-up will be easier than in ambulatory patients. So what is the problem in this case? This research wants to use people who have Alzheimer's. Patients with Alzheimer's disease may be impaired to the extent that they lack the capacity for self-determination and therefore lack the capacity to make decisions. Thus, patients who lack decision-making capacity cannot give informed consent to research studies and might not be able to protect themselves from harm. It is true that when participants lack decision-making capacity, surrogates can make decisions and give consent for them to participate in research. However, surrogate decisions regarding research with mentally incapacitated persons often are not based on the patient's wishes or best interests. As in this case, vulnerable populations are sometimes recruited as research participants because recruitment and follow-up are easier than with more autonomous individuals. Such patients, however, might not feel free to refuse to participate. So vulnerable populations should not be exploited because it is easier and more convenient for the researchers. Fairness requires that vulnerable populations not be targeted as participants primarily for the convenience of investigators, especially if other populations would also be suitable for the study. In addition, researchers need to justify why they are not studying persons with unimpaired decision-making capacity, such as patients with spinal cord injury who require catheters. The use of vulnerable participants for research is more justifiable if the research addresses the condition that makes the participants vulnerable, if it offers a prospective direct therapeutic benefit, and if advocates for the vulnerable population. The principle of justice requires that the benefits and burdens of research be distributed fairly. Vulnerable populations lack the capacity to make informed and free choices about participating in a research project are at increased risk for adverse events from the study. However, justice also requires equitable access to the benefits of research. So, vulnerable subjects should be neither overrepresented in studies nor underrepresented in trials of promising new therapies. So, vulnerable populations such as children, pregnant people, prisoners, or adults with mental disabilities or diseases that affect decision making should not be overrepresented, but they should also not be excluded from research, and appropriate measures should be put in place to protect them. Researches that include vulnerable subjects should provide justification. Children, for example, should not be included if the research can be accomplished by enrolling only adults. It is controversial to enroll children in non beneficial research, especially research that exposes them to more than minimum risks. The principle of justice holds that the benefits and burdens of research should be distributed fairly.